Good morning, everybody, and happy Friday. Welcome back to your Lunch Break Live. My name is Ivana, if you're new here. If you're not, thank you so much for coming back. And this morning we have heard more about these coronavirus vaccines that are coming our way here shortly. But I thought this was a perfect day to talk with somebody, a local woman who has gone through the vaccine trial for one of the COVID-19 vaccines, tongue twister, that is coming. So today I am joined by a local Birmingham attorney, Kyra Fontenot. And Kyra is here today to talk about her experience in that vaccine trial and also just talk about some of the personal feelings she had about it, about just the feeling of getting it, any trepidation she had before that, and also her thoughts about, why people should or shouldn't feel comfortable getting it. So Kyra, thank you so much for joining us. I know this is a topic everybody's been talking about lately, and it's so interesting to hear from a local person like yourself that has been through this and can give us that firsthand account.
Yeah, so thanks for having me. Yeah, it's been an interesting, I think we're now in 2.5 weeks since I've had it, since I got possibly got the vaccine.
Right. Well, that's a good point. I'm glad you said that. So in these vaccine trials, I know so many of us that are not in the medical field may not be familiar, but in these vaccine trials, you either get the vaccine or you get a placebo, and you don't know which one you get. And that's kind of the whole point, to see how you react and how your body reacts to that injection, whether, again, it's that medicine or not. But Kyra, what I think is interesting, number one, I'll ask you which vaccine you may have gotten. And also, how did you get involved with signing up for a vaccine trial in the first place?
So initially, I was kind of anti, being one of the first people to get the vaccine. I had some, just doubts about how quickly these things were happening and whether or not they had really thought it through before they were testing this on humans. And but I started to see some newspaper accounts, I guess, about the need to have a very diverse pool of people who test vaccines to make sure that we don't get a vaccine that doesn't work as well on women or doesn't work as well on Black people. And particularly in the Black community, it's one of those things that, we have some history where things were tested on us, and some of those tests were not ethical. And there were some really bad outcomes, particularly right here in Alabama with the Tuskegee experiments, where they allowed people to just have syphilis just to see kind of how it would, progress. And so I was obviously a little bit concerned about, whether or not this was the right one. But ultimately, as this pandemic started to wear on me, just like it's wearing on everyone else, I was I really started looking at my family and saying, my mom doesn't get to see my daughter. And, she's 9, my mom's 73. They don't have, a lifetime to get to know each other and be together. And this COVID is separating them. And I didn't want that to happen. And so I started to think, well, look, I'm healthy. I'm young. I have no risk categories whatsoever. If I get COVID, then, I'll probably be okay, So if I don't test it, then, who else will? And so I got a card in the mail, and it, asked me to sign up for, I think it was the Moderna one. And it sent me to a website, and just on a lark, I just said, okay, well, let me fill it out. And the Moderna one was closed. And so they actually put me in a separate vaccine, which is for Janssen and Johnson & Johnson. And the next thing I know, I was down there getting tested to see if I could be in the trial.
Well, and you say that you got something in the mail asking for a diverse group of participants in this trial. We know that, unfortunately, we have seen data that has showed that Black people have been disproportionately affected by the coronavirus. And for you, did you feel a personal sense of responsibility? I know you mentioned the COVID kind of fatigue everybody has, but did you feel a responsibility as, I'm a woman, I'm a Black woman, this is something I need to do for my community?
Yeah, I think so. I mean, obviously, we need to know how it works, We need to know how it works on Black people. And if they don't test the vaccine on people of color, it may not work as well. There are oftentimes different therapies that work differently in different kinds of people. And because there are so many people who are scared in my community, I was like, well, it's kind of a low risk, thing for me. I get a flu shot every year. I'm not a person who is scared of vaccines in general. And then I read about what they were actually going to be injecting. And I was like, okay, I think I can handle this, and I just thought it would be, if other people are shy about doing it, we're going to get worse outcomes, and this is going to prolong, and people who look like me may die. And I don't want that to happen.
So you go down and first of all, where did you go? And second of all, you obviously got through that first testing. And tell us what it felt like when they said, okay, we're going to pick you. You are going to be in our trial. Did you have that moment of like, what have I done? Why did I do this?
Yeah, so the trial that I'm in is actually it's at the Simon Williamson Clinic, which is kind of in the western section over by Princeton Hospital. And so I went down the first day, and they didn't really do anything too crazy. They like took your weight, they made sure I wasn't pregnant, that just kind of went over my history, and they said, okay, well, you're going to come back in like 10 days, and then we'll give you the last set of tests, and then you'll get the vaccine. And so that gave me like a little bit of time to kind of get like, chicken, And so over that point, I was like, okay, so then I started like binge reading everything I could about the vaccine. And I did get a little bit afraid, that, maybe it wouldn't work the way they thought it would, or maybe I would be behind the rest of the group. Like if I got this vaccine and it didn't work, then everybody else would get a vaccine before I got one. But at the end of the day, I started to think about it. I was like, well, worst case scenario, I'm in the same place in the line of people getting vaccines that I would have been had there been no trial. And you'll probably survive it. The vaccine that I potentially got is really a dead cold virus. And so I've had a cold before. And ultimately that was like, okay, you've survived every cold you had since birth. You'll be fine.
When you realized you were going to be in this Johnson & Johnson vaccine trial, when you told your family, assuming you told your family, how did they react? How did your spouse react, or your mother? I know you mentioned a minute ago. Did they think that you were absolutely Looney Tunes for doing this, or, were they respectful and proud of you?
So no one in my family really reacted too much originally. And then about a week ago, my mom was like, I wish I could be in the trial. So it kind of like, once we start to talk about it and we normalize it, I think people start to think, oh, well, it wouldn't be a bad idea for me to try this thing out. I think part of it is most of the conversation about the vaccine development has focused on the risks and not the potential rewards that we can get by getting back to our daily lives. And obviously there are risks in everything, but there is a huge risk in us getting COVID. And the funny thing is, so, I got the vaccine trial the week before Thanksgiving, and this week, 2 of my family members got COVID. And so now everyone is definitely like more heightened and more concerned about catching that disease. And so, I think as this kind of picks up, I think more people will probably realize that, getting a vaccine and those risks are less than the risks of getting sick and having major COVID complications.
I have so many questions for you. I'm trying to figure out the best order to go in. But first, I'm going to take a couple from our viewers. I got one from my friend TJ, who says that he is he doesn't normally take his flu shots, but he would consider taking this vaccine. TJ, you got to tell me why you don't take your flu shot. I'm curious to know why that is. No judgment here. I just want to know why, and I want to know why you think that you'd be okay with taking this one. So TJ, get back to me on that one. And we've got some other questions. I know Tyler made a point here here. And you mentioned a minute ago that this Johnson & Johnson vaccine trial that you're involved with, that vaccine, you said had a part of a dead virus in it, or a part of a dead cold, I think you said.
Mm-hmm.
So this is not that mRNA vaccine that we have been hearing about that is not a part of the virus, but is more of a, I don't want to use the incorrect terms, but something more of a genetic vaccine to tell your body how to make those antibodies. So, Kyra, did you go into this saying, I don't want an mRNA vaccine, I only want a dead virus vaccine, or vice versa?
I did not. I did not until I signed up and they matched me with a study. I didn't know what technologies they were using in each. But as I started to look into it, I found that the technology that they're using is one that they have used on Ebola and other virus vaccines that they are currently using. And so I think I'm not sure that it doesn't operate the same way, but this one is a little bit more shelf stable. It can be kept at a higher temperature. And so this one would be, if it's working, will be one that would be more able to be used by a greater population. So this one actually, if you think about it, people in rural areas where they don't have quick access to medicine, or this one actually might be a better one for a larger group of people.
Now, my friend TJ responded here and said that I love this phrase. TJ, I'm going to steal it from you. He says, I can man up through the flu, but you can't big boy your way through COVID. I love it, TJ. Thank you for your words of wisdom there. But I have a couple of questions here, Kyra, talking about people saying, I won't take this shot until makers of the vaccine take the shot in public. We know that several former presidents have said they will go out and do this, take this vaccine in person. We heard this morning from the mayor and from the deputy health officer at the Jefferson County Department of Health. That officer said, if it takes me going out and live streaming me getting the shot, I'll do it too. Kyra, what are your thoughts on what will make people comfortable to get this vaccine? And also, is that why you are being so outspoken about your experience?
Yeah, definitely, because I think I know it's prevalent, at least in the Black community, to be very skeptical of vaccines, medicine in general. And if we don't make an example and say, okay, you're going to be fine. Like I didn't get the flu vaccine, but I had a friend who died after having the flu. We all 3 friends got the flu at the same time. 2 of us got treatment, 1 of us did not, and 1 died. And it was a young person. And so when I see that, and I know what, this loss could be like, and the scale of this loss, we have to do everything we can to stand out and stand up and have people say, take this risk, take the vaccine. You are limiting a much greater harm if you take the vaccine.
Kyra, you mentioned earlier on about especially people in the Black community being sometimes a little bit wary, maybe more wary than the white population or other populations of things like vaccines because of experimental medicine that has been used on Black people in the past, and especially with Alabama's history of that. Do you think that the Black community maybe has more fears about this than the white community for that reason?
I think so. At least from I'm talking about, I have a pretty diverse group of friends, I hear a lot more encouragement and like, "Yeah, you did this," from my white friends, and my Black friends are like, "Let me know."
Good luck.
Yeah, in fact, one of them says, "Man, you're always doing something crazy like this," and it's true. I think there is just more of an acceptance, I think, of what medicine can do for you, because people who maybe haven't had those same experiences wouldn't even fathom that medicine would experiment on people without anesthesia, or allow their disease to progress just to watch and see how it goes. And so there's just a level of trust in medicine that I don't think is the same in the Black community universally. Obviously, different people have different feelings, but I do think there is a higher level of distrust.
And I think that's so interesting. And we talked about that Tuskegee experiment earlier, but somebody mentioned, Twyla mentioned Henrietta Lacks, excuse me. And
Mm-hmm.
Twyla, you're so right. I will say, when I was a freshman in college, before I went to college, that book was required reading. And I am very thankful that it was. Great book. If you have not read about Henrietta Lacks, you definitely should. Now, I have a couple other questions from you, and this one is from Shonda. We'll start with that. And Shonda said, does the vaccine, assuming, again, you got that vaccine, because you also could have gotten the placebo, did you have any side effects?
My arm hurt, just like any other shot. So this was kind of funny. So I have seasonal allergies, so my nose kind of runs, or I might be congested when I wake up. And so after I took the vaccine, I kept kind of double checking to see, do you feel different? Do you feel different? And then for about 4 hours, I was like, well, I've had other vaccines and my arm hurts more, so this was probably not it. And, and then I woke up the next morning and I hadn't had any nasal drip for weeks. And the next morning after I took it, my nose ran for about 10 minutes. And then it went away. And so it was probably my allergies.
But like we said earlier, when you, for some reason, you get it in your brain, and even if you think like, I'm not going to be that person, for your brain is always going to say, wait, was that a symptom? Or wait, was that maybe a sign that I got the vaccine instead of the placebo? We have a question here from Linda that I think is interesting. And she says, if you do the trial, do you get any kind of documentation that says you were in the trial or that you've had the vaccine?
Yeah. So there's a thick packet of information you get about what you're in the trial. And they also contact your normal doctor and they let them know that you're in a trial. And if you start to have symptoms, you actually, instead of going to your regular doctor, you go to the vaccine clinic and then let them test you. Actually, they gave me a home test. I have to test myself for COVID first, which is, let me tell you, it's unpleasant. If you haven't had a COVID test, let me tell you, it is unpleasant. But they gave me a thing to test myself, and I have to take that back to there. So they will track me for, I think right now it's up to 2 years. And there's some people in the study who will be tracked even more frequently. But but I won't be told what they're finding. So if I don't get symptoms, if I don't get sick, then I won't know whether or not I have antibodies. And neither will the researchers. They're just going to take the samples, send them off, and it's all randomized.
Will you ever be told if you were given the medicine or the placebo?
I think at the end, but that's 2 years from now. But I do think that since most of these drugs have been speeding through that first phase, because obviously no one's been in a 2-year Moderna study, if they find that it works, I think in some other studies, what they have done is given the real drug to the people who got the placebo. So there's a chance that you might find that out, but that's not guaranteed. It could be that you could just be in the study for 2 years to see what happens.
So we know that you're in this study for 2 years. When the vaccine comes to Alabama for more general distribution, we know those first doses are going to hit here in a few weeks, but the average people like you and I will not get those vaccines. Ours will be a little bit more into next year, into maybe the summer, I think we've been told. So when those hit, and say when the general population can go get vaccinated, are you supposed to go get vaccinated, or do you just have to sit back?
I'll wait. Yeah. Well, based on my life and my profile, I would have been at the back of the line anyway. So it wouldn't have been much of a change. But no, I won't get it. Yeah. I'll see what I have here.
That's so interesting. And also I'll have to ask you then, like, if that will give you any sort of fear or any sort of stress when you see maybe your husband or your family members getting it and thinking like, well,
I just want 70% of the population to get it. If everybody gets a vaccine of some sort, I don't care. It's really just as many people who can get a vaccine as early as they can get it. I think, if I'm not the first one, that's fine. If I got a placebo, that's absolutely fine. Yeah.
And another question that I have in this trial, and I have this question in all trials, but in the one you're in Johnson and Johnson, we know that some of the things that we are doing as a population, or that we're recommended to do, social distance, wear masks, et cetera, can prevent the spread of coronavirus. So if you get this medicine, we'll say that you did get the medicine, although we don't know. Say you got this medicine, but you are doing those things and taking those precautions anyway. How will we know if that medicine worked, or if it was the masks and the social distancing that worked?
That was the thing that I was really interested in too. And so I looked it up, and what they do is they tell you to live your life the way you normally live your life. So in the study pool, then you're going to have some daredevils, and you're going to have some people who are like social distancers, And I actually put myself sort of in the middle. Like I'm not at home right now. I'm at a meeting for work. I have a mask though, just so you know. And so I have to go out. I'm a lawyer. I actually have a trial set in 2 weeks. I will have to go out and be in the world for my job. Sometimes I have to go to depositions, and those are in person. And so there's a subsection of the people who are taking the amount of risks than I am, and there's a subset of people who are probably going to bars, and doing all kinds of crazy things. And there's probably a subset of people who are at their house most days and don't leave. But what will happen over a time, a set number of them will get coronavirus. And then they will check that data to see which of those who got the coronavirus were in the placebo, and which of those were in the group that had the shot, the actual vaccine. And what they found in the other ones that have come through is that 160 or 170 people got the coronavirus, and like 9 of them were with the vaccine group, and 160 weren't. That's a statistical difference that is enough to say that the vaccine is working.
So when, like you said, you maybe have some people that are taking more risks than others, do you have to report that to your trial, to the people in charge?
No, you just, on Mondays and Thursdays, I just tell them, I have a pulse oximeter and a thermometer, and then I report whether I have symptoms on Mondays and Thursdays, and that's it.
I have one more question from you, and this is from a couple of people that I have heard from on different platforms and here as well. And that is, what do you say to people who say, I'm never going to take a vaccine. A vaccine maybe has some sort of tracking device in it, has a chip in it, or people who just have such distrust of this vaccine. No matter what they're told, or no matter what data comes out, they just say, look, I'm not taking it.
Yeah, that's unfortunate. I think, we can't, we beat polio. We beat chickenpox. Like, I got chickenpox. My child will never have chickenpox. We have vaccines that stop us from having tetanus, diphtheria, like all kinds of things that used to kill people. We get a shot and we live longer. That's why people in 2020 live to their 70s and 80s instead of the 40s, which is what it was in 1800s when we were all toughing it out. And so, I understand that there are concerns about those things, but you really have to look at the incidence of vaccine adverse events as it relates to the incidence of COVID-related deaths. And so, if you're really looking at the numbers, the potential downsides are very starkly weighted in not getting the vaccine. It will be much higher if you don't. So I would hope, I don't want to shame people, and I don't want people to say, that's, it's not backed by science, but the reality is sometimes science is a good thing, and we should trust it.
Well said. And I would love to hear from some people who maybe feel that way now and maybe change their minds. We know I'm going to check in with TJ later and next year and see if you get yours. I would love to hear from people too that have those differing opinions. So Kyra, thank you so much for coming and explaining your experience. I think a lot of people sometimes feel like there's kind of a curtain up and we don't get to actually hear from the people who are involved in testing this potentially life-changing vaccine.
Yeah. Well, thank you for having me.
Thank you, Kyra. Everybody, thank you so much for tuning in today. Everybody stay safe and healthy, and we will see you Monday.